Hi everyone, kia ora. My name is Prudence. I'm the Manager and Director of Accent Health Recruitment, and I'd like to introduce Hayley.
Hi, I'm Hayley. I'm one of the Senior Recruitment Consultants at Accent Health Recruitment.
So today we're going to run through the interview process. We're going to talk through questions and give you an examples. It takes about 15 minutes and it's a really important part of preparing for the interview we're going to find for you. So today I am Prudence the nurse. I'm coming to New Zealand and I'm having a video interview. Before we get into the questions with Hayley, it's just really important to remember you've got a great surrounding, a lot of light, a good background, and also remember, please put your iPad or your computer on a stable surface, because if you get nervous, you don't want it moving. So let's get into the preparation. Thinking about coming to an interview, you're dressed appropriately. Today we're in our accent clothes. But what you want to do is think about preparation for the interview as if you were having it face-to-face, research the location, research the employer, and have a really good idea on the role that you're going to. Find a quiet room and put your phone on silent, but keep it near you just in case we have to contact you. Keep your CV with you and be prepared for all the case scenario questions. Some interviews take 10 minutes, some interviews take 10 hours. So let's get into a few of the questions.
Right, so basically first we're going to ask you about, tell me more about yourself, Prudence.
Okay, my name's Prudence. I'm 51. I've been a nurse for 30 years and I work in operating theatre. I've been in theatre for the majority of my career. I work in orthopaedics as a scrub nurse. I do anaesthetics, paediatric, adults. I do a little bit of recovery. I particularly enjoy trauma and I've done a trauma course. Yeah.
Oh, great. So with the interview, so that we do answer in what we call a STAR format, which is like, think of the situation when we get to the behavioural questions, situation that you faced, what you did in that instance and why, you outline your response and justification, and you elaborate on the outcomes. So probably half and half of the interview, half of it will be about yourself and your background and what you are currently doing. And the other half will be behavioural type questions, asking you about situations that you will face on a daily basis in your role and how you will deal with them. Also, probably the last third will be about, obviously, you're moving to a new country, you're going to be living away from your friends and family, and how you're going to cope. The employer's going to want to know that you've already thought about joining clubs, keeping support, because being homesick is a real thing and it can be quite hard to deal with, and it can take up to about a year to settle. So the next question we would ask is, why do you want to work in New Zealand, Prudence?
Well, I've been to New Zealand. I came as a backpacker when I was 20, before my nursing career. This is my alter ego, I think, that I'm talking about. I loved it. I went to the North and South Island, and I also took the ferry down to Stewart Island. I really want to work in New Zealand because they've handled the pandemic really well. I really love what the government stands for, and I'm a very enthusiastic rock climber. And I know that when I go to Northland, for example, they've got some great rock climbing clubs. I've already seen the Beachside Rock Climbing Club, and I really want to work there. Yeah.
Right. So obviously Northland, you know where we are, Whangarei.
Yes.
And what else do you know about the area?
That's a really good question, Hayley. I've done my research and I know about the population. I know that there's quite a high Māori population. There's quite a high incidence of diabetes and obesity in particular areas. There's a lot of people migrate there, and it's a really fabulous weather and lower cost of living, which is really great. I understand there's the main public hospital, Whangarei, where I'm going to work in theatre. Yeah.
Great. Tell me about what makes good teamwork and how would you fit into a team?
Yeah, teamwork's really important, Hayley, especially in theatres. So working as a team member, I think it's communication and commitment and caring. So the 3 C's. I think communicate with your team regardless of how much experience you've got. And I think thinking about coming into a new environment, sort of sit back and listen to start, learn how they do things in New Zealand, and really employ your communication skills. Show a commitment, so assist your team leader and also assist the junior members, and also be very caring and gentle to new people coming, or if they've come off a long shift, or if there's been trauma or something. I think it's good to communicate.
Great. And so how would you prioritise your workload in a busy day?
Yeah, prioritising is really important to me. I often make lists. I come early to work. I talk to the surgeons and the anaesthetists and work out what's a priority as far as if we're doing trauma on call, if we've got any tricky patients, if there's any infectious patients, they would go last in theatre, I guess. Just looking at the sterile supplies, bringing back a lot of my nursing knowledge here. And I think communicate with your team.
Great. And so what about a situation that you've been in when you didn't know what to do?
Yeah, that would be really interesting. Actually, last week we had a paediatric patient who had she had spina bifida, so she had a difficult airway. I hadn't dealt with it before, and the anaesthetist was pretty knowledgeable, but he was late to work. So we had to really communicate with the mother, and it was really tricky. I felt I was out of my depth, but I talked to one of my colleagues from recovery, and they talked us through the intubation methods, and it worked out really well. But I think I'd like to research it more before I intubated or was in theatre with a patient with a difficult airway like that before.
Great. Yeah. How would you deal with an unsafe situation? For example, you saw one of your colleagues about to give a medication that was the wrong medication, wrong dose, wrong route, wrong time.
Yeah, I actually had a case like that last month. I had a patient who had just come into theatre, and there was a new graduate nurse. So what I did was I kept it safe. So I put the patient safety first. I made sure the new graduate nurse wasn't embarrassed, but I pulled her aside and I said, look, that's an IM injection, intramuscular, instead of IV. So I took her aside. She was a little bit disagreeable, so I had to report her to the manager and say, hey, look, this person needs a little bit more support. So I think safety comes into it.
So safety, and if you feel like perhaps you're not being acknowledged, taking it that next level up.
Yeah, and documenting it, discussing it with my colleagues without making it awkward. Yeah.
Perfect. So what would you do if a drug error was made in theatre?
Yeah, that's a good question. I would check what the protocol is for the District Health Board, but I would immediately check the patient's baseline observations. I would report it, I would document it, and I would follow up. And I think each hospital would be different, but it's really important to follow their guidelines, and they would have guidelines in place, I assume. Yep.
Yeah, absolutely. So tell me sort of more about your strengths and your weaknesses.
I believe that I've got 30 years experience. I find that I'm efficient and knowledgeable, and I'm really popular and really funny. My weaknesses are probably talk too much. So that's something that I'm aware of and I work on.
Okay, great. That's good. What do you think will be your biggest challenge in moving to New Zealand and coming to this role?
Yeah, coming to New Zealand, I think because I'm coming out by myself, I think it'll be a challenge to get to know people, but I'm going to join that rock climbing club and the local church, and I'll probably volunteer for the city mission. So they're the 3 things that I want to do that I continue from home. Yeah.
Okay, and then obviously you're coming to New Zealand, you're starting a new role. What do you want to get out of this job?
I want to get residency in New Zealand that NZ Shores is going to help with, and I need a job offer to get that. So what do I want to get out of this job? I want to learn more about the New Zealand culture, particularly the Māori culture. I want to get paid and do my nursing. And I love my nursing, I love theatre, and that's what I want to do.
Great. And on that note of the Maori culture, can you tell me more about your understanding of Maori culture and healthcare and the Treaty of Waitangi and how that all works together?
Sure. Yeah, so I've done some research on this, Hayley. The Treaty of Waitangi was a signed historical document, and when it was translated, there were some discrepancies. So it made things unfair or a little bit difficult for some of the Māori people, the Maori people being the indigenous people. And I understand that there's 3 principles. There's participation, protection, and partnership. And they are the principles of healthcare in New Zealand. For example, if I had a patient come into the ward and they were diabetic and they had very high blood sugars, I would work in participation with the family. I would protect the cultural needs of the family and protect the blood sugars and protect the drug doses. And I would also work in partnership and protect. So it's just all about being really sensitive, like I would for an Arabic or a Chinese or an Aboriginal or any person from any other country. And honestly, I would ask, because I'm not sure. I'm not sure about all the nuances of the Māori culture.
I think that's probably the most important thing, is just never to assume. Is you would always ask, how do you want to be treated? What can I do here that's going, is there anything I could do that was going to be uncomfortable or go against your cultural safety or practices? So I think it's really good if you just, like you said, never assume. So obviously we're getting sort of to the end of the interview. Well, have you got any questions for us?
Yes, I'd like to know what your training and induction is like.
Okay.
I'd like to know what kind of equipment you use in theatre, and I would like to know what the process is from here.
Perfect. Okay, well, we can go through the induction thing, protocols when we get closer to a job offer.
Yeah.
From here, what we're going to do today is go away and have a think about it.
Yeah.
And get back to you in a couple of weeks.
So you're not giving me an answer right now?
No. So I think what you'll find is you won't be given an answer on the day. In New Zealand, it's not really the done thing to talk about wages or salaries to in interviews. It's just most of New Zealand nurses are paid on a general scale, which means they all get paid the same regardless of where they live in the country, and it's all on experience. So it's not really brought up, and a lot of the managers don't actually really know how much everybody gets paid because it all gets done by the HR department. So you can ask about shift work, absolutely, what the expectations will be of you, possibly whether they would offer some part-time hours. And when we say part-time hours, with anything over 30 hours a week, you will have to have for your visa, but you could work 0.8 or 0.9, which would be 8 or 9 shifts a fortnight, and there's definitely flexibility around that. So there's the sort of things you could ask. Also asking about personal development and what they can offer you in ongoing training and things like that, study days and things like that a year. So that would be the sort of things you would be asking them about.
Yeah, I think a lot of the questions that we get also are, tell me about a time. Tell me about a time something was negative happened and what the outcome was. Tell me about a time that you made a positive difference. Tell me about a time you made a mistake, which is always a good one. Some of the interviews we find are very relaxing, very informal. Often, technically, they don't happen on time. A camera doesn't work, a phone doesn't work, but we're always there for backup. But we've got a list of questions that we can send to you, and we can send them all through to you by email so you can have a practice. But really, it's a two-way. Treat it like a date, two-way conversation, and learn something about the hospital.
Yeah, and don't be afraid to let your personality shine through, and warmth and compassion and things like that. Like we said, it can often be very relaxed, and you will walk away thinking, perhaps, was that the interview? They really, in New Zealand, it's obviously, they know what your skills are and experience are from your CV. They really want to get an idea of, will you be a good fit for their team? So it will be about looking for a good team player.
Yeah, and probably lastly, if they ask you a question and for whatever reason, because the screen freezes or you're not sure of the lingo or the terms, just say, can you please repeat or rephrase that? So if they ask you, how often do you change an IV lure? And you're not sure what an IV lure is, which is an IV cannula, just say, could you rephrase that question? And always say, don't be afraid to say, hey, I don't know the answer, but I'd find out if I was to get a job with you. I'd learn.
Yeah.
So good luck, guys.
Yeah.
Smile when you're having your interview, and yeah, we wish you all the best of luck.
Great.